So exam 1 covers weeks 1 through 3, and that is going to be chapters 15 through 20, which were all of our growth and development chapters. And then chapter 22, which is the first chapter that talks about hospitalization and how that affects pediatric patients. So your study guides from weeks 1 through 3 will help you to narrow down information, as well as the extra resources that we gave you for this first exam. So after this first exam, you will only have your weekly study guides to go from and these exam review PowerPoints. So for exam 2 and 3, that's all you guys are going to get, and the math resources as well. So let's dive into our information here and make sure that as I'm going, if you have questions, that you stop me, interrupt me, please. A lot of times I'll just keep talking unless you interrupt me. So let me know if you have questions along the way. But we are going to start off with some vocabulary. So when we're talking about,
I'm sorry. Is it okay if I take a picture?
Yeah.
Okay. Thank you.
Um,
I mean,
our cephalocaudal development is that proceeds from head to toe. So that means we have control of our head before we gain control of our torso and before we're gaining control of our legs. So I can lift my head up and have good head control before I can sit up, before I can stand, before I can walk, run. That's that cephalocaudal. Our proximodistal is going to be starting at the midline, so the center of your body, and moving out to the periphery. So from your core strength, your core stability, then we start to be able to do things with our arms and our legs, working our way down to our fingers where we have those fine motor movements, those really advanced skills. So that's going to be that proximodistal. We're working in the middle first and then going out to the extremities. General to specific is how we develop our motor functions, our physical functions. So we're able to do something very general, like I can throw a ball. As I get more advanced, I can do something specific, like using my index and my thumb finger to be able to do that pincer grasp. So I can do something general where it's requiring my entire hand. Something specific is going to be that fine motor skill that we're looking for. And we know that we always progress from general to specific. So we can do big things before we can do really detailed things. Maturation is going to be our umbrella term that covers all of growth and development. So it includes the total way which a person grows and develops, so all of those characteristics rolled into one, as dictated by inheritance. So we're looking at all of the factors rolled under one big umbrella, and that is maturation. When we're looking inside our umbrella and we're talking about strictly growth, we're talking about that change in our physical size. So growth is something that you can measure. Development is that increase in our body function. So the skills that we're acquiring, the things that our body can do that it wasn't able to do in the past, that's our development. So both of those are rolled under maturation. Heredity is that factor that develops maturation. So what we inherit from our families, those things that are unique to us as an individual. And then we're looking at different types of families. So our nuclear family is that traditional mother, father, biological children. That's going to be your nuclear family, the smallest cell. Then we extend out into our extended family that includes our grandparents, relatives, extended family members. If we have a blended family, we're talking about somebody that's been remarried and has children, either from both sides or maybe just one side, but they're all blending together. So mixing of multiple families. And then alternative families are those people outside of biology that you consider family. So if you have a really tight-knit community and you all pitch in together to help raise the children in your family, that would be considered an alternative family member. Next, we're going to move into types of reflexes that we need to be aware of. So the first one is the extrusion reflex, and that's where an infant will stick their tongue out if you put food on it to keep that food from going in before they're capable of swallowing it. So that's why we wait until they're at least 4 to 6 months old before we're starting solid food. That's when we expect that extrusion reflex to go away so that they're not spitting out everything that you're putting in their mouth. Next is our grasp reflex. So that is if an infant has their hand open and you stick something in their hand, they're automatically going to close their fingers. So that's that grasp reflex. So as soon as you touch their palm, they flex their fingers and close their palm. Prehension is being able to grasp objects between the fingers and the opposing thumb. So being able to use your fingers and your thumb together to grasp an object. Then our parachute reflex is a protective measure where we stick out our arms and legs and kind of turn ourselves into a parachute when we are suddenly thrust downward. So if you were holding an infant by their waist and you kind of stumbled forward with them, you would expect that they would stick out their arms and their legs to brace themselves. That is that parachute reflex.
When do they start that? Or is it just always a natural reflex?
That occurs between 7 to 9 months is when
Okay,
we really see that one.
thank you.
Negativism is how toddlers test their control by saying no to everything. So negative no, it's a way to gain control for our toddlers. So that's why if you ask them a yes or no question, every single time they're going to say no, unless it's something they really, really want. But their favorite word is no. And that's that negativism and them trying to assert their own power and control over a situation. Ritualism, on the other hand, is their grasp at that sense of security by always following the same steps and the same routine. So ritualism, they have those compulsive behaviors and routines. I always put my left shoe on, then I put my right shoe on. When we go down for nap, I want a story. I want my sippy cup. I want this specific sippy cup. I want this blanket. I want to rock for 10 minutes. I want you to read me a book, and then I want to lay down in my bed. That schedule of events is another example of ritualism. Taisha, did you have a question?
Yes. So do we have to know the ages for all of these, like the grass reflex, rehension, parachute reflex?
Yes. Yep. Yeah.
Okay.
Yep. Make sure that you know ages that go along with them as well. Yep. And those are in your textbook. And I believe it is table 15.1, I think, is where the reflexes are. We're looking at those developmental milestones. So those are going to help you with these reflexes as well.
Well,
Next
I have
up,
one question.
yeah,
If it's too loud, just tell me. We're getting a new roof, so I'm sorry.
you're fine.
So I attended another review, like just
Mhm.
briefly, but then I got out because I'm used to like coming to your class.
Yeah.
I got a little confused because I was trying to learn like the specific ages under like neonate, infant, toddler, preschool, etc.
Uh-huh.
And her reference was different than like what we went over and what's in the book. So I kind of got a little confused. Like
Always go
for
with the
toddlers,
textbook.
Okay, because for toddler, I have 1 to 3, but she was going up to 5 for toddler, and I'm like, "Oh, no." So I signed out because I did
Yeah.
not want to confuse myself.
Yeah. Yep.
So
Nope,
for
you're right.
toddler, would you consider 1 to 3?
Yes. Yep.
Okay.
Yeah.
Okay. Yeah. So, all right. Thank you.
Yeah. Yep. Always go with your textbook.
Okay. Thanks.
Yep. Okay, so after we go through negativism, always saying no, ritualism is that normal routine that we have, that compulsion um, that we have to follow for that sense of security. The other thing that we need to look at is personality. And this is all of the unique characteristics that determine your typical or recurrent patterns of behavior. So the things that make you you, and based on these characteristics of you, we can predict how you're going to respond to something. So that is your personality. So we know some people, we have that characteristic type A personality. So they are very logical thinkers, cut and dry. They don't want any fluff. They are factual thinkers. Those are all characteristics that make up that stereotypical type A personality. When we're looking at types of play, remember we talked about parallel play, where we're playing next to another infant or toddler, but we're not going to be playing with them. So for parallel play, we're doing our own thing, but we might be in close proximity to somebody. This is not on here, but as we're moving along the play continuum, we get to associative play, which is we might be sitting with somebody and we're both playing with blocks, but we're going to be building our own towers. We might be talking to each other about our towers, but we're still being somewhat independent and not relying on that other person. So that's that associative play. We're going to see that more in our preschool population as they're starting to learn how to socialize. And then we're finally going to get into cooperative play right before we hit grade school. So our school age kids are going to be learning cooperative play, which is where we can all work together to build one really giant tower together. So we go from playing next to somebody doing our own thing. We're both doing the same thing, and kind of talking to each other. And then we get to that teamwork stage in that cooperative play. The reason that our toddlers are not capable of cooperative play is they have that egocentric point of view. So egocentrism is where they don't recognize anyone else's point of view. Everybody sees the world the same way that I do. So if I think that the sky is green, then I think everybody thinks the sky is green. And I can't consider that the sky might be blue. So even though we all have different points of view, different thought processes, a toddler is not capable of recognizing that. So however they see the world is the exact same way that everybody else sees the world. I can only think about my feelings and how things affect me. I can't think about other people yet. Does anybody have questions on vocabulary things?
Can you just flip back one time to the other vocab real quick? I was just going to take a picture of you.
Okay. So next we're going to talk real quickly about growth and development. So we have different influences that affect how we grow and develop. So all those outside things that cause us to, that shape and mold us. So our heredity, the things that we inherit from our parents, the things that are passed on through genetics, that's going to influence how we grow and develop. Also, our nationality and race. We know that certain ethnicities are going to be more at risk for certain diseases. They're going to be more prevalent, especially our metabolic disorders are going to be really tied to ethnicity a lot of times. So that will influence how we grow and develop if we do additional testing to make sure that we're not at risk for things like that. And then we've talked about in class our ordinal position in the family. So this is your ranking in your family system. So are you an only child? Are you the youngest? Are you the oldest? Do you have siblings? Do you have close cousins, relatives that can influence you? Where you rank in the family kind of dictates the level of responsibility that we expect for you. Also, how many other people you have to influence your growth and development. Gender also influences. We know that gender roles play a part here in how we grow and develop and learning about how we fit into society. And then our environment. Do we have both parents at home that can help to mold us and grow us? Do we have two working parents that we rely on going to daycare or a babysitter where we're exposed to people outside of our family? Our overall environment is going to have a large influence on our growth and development. And that can be your actual physical environment as well, what your housing structure looks like, your access to food, that can all be considered in your environment as well. And then quickly, this is something that we kind of very briefly kind of glanced over in class, but different styles of parenting. So we have 4 different parenting styles that we see, kind of big umbrella terms as far as different ways that people choose to parent.
Excuse me,
Yes.
Professor Starr. Are you going to post the PowerPoint with the recording?
Yes. Yep.
All right, thank you.
Yep. So authentic parenting is going to be that really nurturing, affectionate parent. They do set boundaries. They're going to discipline through guidance rather than punishment. And they're going to really foster that open communication. So this is kind of that like ideal scenario of what every parent kind of strives to be. They want to be really nurturing, affectionate. They want their child to respect their boundaries and have that good relationship with them. An authoritarian parent is going to be very strict. They have high expectations. They are not flexible in their rules or expectations. And they are going to tend to rely on punishment over discipline. So they're going to be more apt to punish a child for wrong behavior than providing that guidance and that open communication and talking through what went wrong. They are, you follow the rules because this is what we expect of you. And if you don't, this is what's going to happen. So very cut and dry. Indifferent parents. So these are parents that we definitely need to keep an eye out for. They are emotionally detached. They're just kind of going through the motions, not really paying attention to their children. They don't set any boundaries. They don't interact with them. They are more focused on themselves as an individual than actually parenting their child. So we need to watch out for that because that could be a sign that we've got something else going on. We might have a postpartum depression, could be early warning signs. So we might need to get some extra support in there with an indifferent parent so that we don't have a child that's not in a safe environment. Permissive parents are kind of like our authentic parents. They are also very nurturing and affectionate, but they are inconsistent with their boundaries. So they are more focused on being their child's friend than necessarily their parent. So if I know that the rule is that we go to bed at 9 o'clock, but you tell me you really want to stay up and watch a movie with me until 10, I'd rather let you stay up until 10 because you're going to think of me as the cool parent and I get to be your friend and I don't have to make you upset. So I'm going to let you break the rules just because it kind of smooths over that relationship. So that's going to be your permissive parent. Do those make sense to you guys? Okay. That's not something we touched on really heavy in class, but you may see a question on your exam about it. We did talk about the fact that discipline should be focused on teaching rather than punishment. So we need to understand the reason behind why we can't do what we thought we could, and the reason or the safe thing that we can do instead. So discipline is going to be things like timeouts and setting those limits. Remember, when we're giving timeouts, it's 1 minute per year of age. So a 5-year-old would be in timeout for 5 minutes, 10-year-old would be in timeout for 10 minutes. And then having those good limits set in place so that the child knows how to stay safe. Okay, now to the meat and the potatoes, what everybody is dreading and waiting for, the theorists. So I try and find one word related to each theorist that kind of is my keyword. Like, this question is asking about this general concept. That helps me figure out which theorist I'm talking about. And then as we're going through the different stages, finding out those characteristics for that stage. So what's that keyword that's going to give you an idea of who we're talking about? And then going through those characteristics. A lot of them are going to match up with your developmental milestones again. So if you know that in our toddler ages, we are working on potty training, then it makes sense that we would be in Freud's anal stage, because that's where we're learning how to control our body secretions. So Freud is all about psychosexual development. So it's all about where pleasure comes from and what we are learning to control. So our oral stage is birth to 1 year. So our infants. And we know that pleasure is derived from their mouth. So they suck on a pacifier to self-soothe. They're learning how to eat by themselves, tasting new foods. And they are learning about their environment by putting everything in their mouth. So that is going to be your oral stage. So our infants, everything's in their mouth, oral stage. We talked about toddlers are in the anal stage, so 1 to 3. In our anal stage, we are learning how to control our body secretions. So we really see this with potty training. Our phallic stage, our 3 to 6-year-olds, are going to be our preschoolers. So this is where our sexual energy is going to be centered in our genitalia. Our relationships with parents of the same and opposite sexes are going to start changing. So boys are going to be more attached to their mother. Girls are going to be more attached to their father. So that's where that Oedipus complex comes in at this phallic stage, if you remember that. In the latency stage, this is where our sexual energy kind of takes a back burner. We are focused on privacy and understanding our body. So at this point, we're going to be spending more time with our same-sex peers. So sticking with people that are like us. This is that stage where boys have cooties. That school age time where we're really focused on those same-sex peers. Then once we hit puberty in our adolescent stage, we are going to be in the genital stage, and we're going to reverse that. We're fully matured sexually. So we are going to be working on those first romantic relationships. Questions on Freud? Okay. So just breaking it down again, our infants are in that oral stage, exploring the world with their mouth. Anality, that anal stage, is also going to correspond with that toilet training and learning control. So this is where we see that negativism come in, where we're always saying no to everything. And we've got that ritualism. So that also falls into here. We know that we always do things a certain way. So especially when we're learning a new task, we like to do it the same way every time so that we get really good at it. So that's that ritualism. In our phallic and Oedipal stage, that's that school age, our preschoolers are becoming aware of themselves. They're learning that boys and girls are different. and that we're made differently. So they're starting to learn all of those little nuances. And then we get into the latency stage in our adolescence, where we're learning.
No, because I made pancakes and I opened one that was in there. That's the only reason why I threw away the other one. That's the one I threw away.
We are working on peer relationships and learning how to live in groups. So when we're in that latency stage, we're learning kind of how we're going to live as we're an adult. Moving on to Piaget. So he is all cognitive development. So how we think about things, our thought process, how we see the world. So we've got our 4 different stages here. Our sensory motor stage is typically our infants. So they are learning through their senses. So kind of Freud fits in right here as well, where we're learning through things that we put in our mouths. We're learning what we can see, what we can touch. We're learning new taste, smell. We're learning motor activity. How do we move around in the environment? We learn things like object permanence at this stage. So if I hide your teddy bear under a blanket, you no longer think that Teddy has disappeared. You just know you have to move the blanket to get to your teddy bear. So that's that object permanence. Something exists even if I can't see it. Same thing, if mom walks out of the room, I know that she can come back. She didn't disappear for good. That's object permanence. We also see some stranger anxiety here as we're learning about and exploring our world. We're getting some very basic language development. Then we're going to move into the pre-operational stage. And this is where we are thinking by using words as symbols, and we don't have logic yet. So our logic hasn't been developed. So we use symbolic thinking. So using a box to be a race car, or using a pot or a pan as a steering wheel for your race car, something like that, is an example of that symbolic thinking. So using something outside of its intended purpose. They're learning the right words for things. So when we don't know the right words for things, that's when we're going to be relying on those symbols, but we're going to start to develop our vocabulary at this point. We see imagination starting to develop at this point, but we still can't do that advanced thinking yet. So some of the things that we see in the pre-operational stage, we see that egocentrism. We can't see things from other people's perspective. We see transductive reasoning, where we're drawing a conclusion from one fact to another. So things like cause and effect. And then we see a lot of magical thinking. So belief that events occur because we wanted them to. We thought about it, we wished it to happen, so it happened. We can also see centration, which is where we are going to focus on only one aspect of a situation. So if we give you a Lego set and ask you to sort the Legos, you may decide to sort them by color. So you aren't paying attention to the shape. You're not paying attention to the size. The only thing you care about is sorting your Legos by color. Your neighbor might choose to sort them by size. So that centration is that laser focus on that one aspect. We also see animism. We talked about this with our Kahoot. We did that question about the tree having leaves to be able to hide behind. So this is where we are giving life to inanimate objects. So human characteristics to things that are not human. Do those make sense? So far on the same page? Okay. Concrete operational is our next stage. So that's going to be our school age children. And they are really developing that cause and effect thinking. Their reasoning is going to be tied to those concrete experiences that they've had. And this is where we see concepts like conservation. So in the video that we did in class, they talked about having a tall, skinny glass and a short glass, and knowing that we can have the exact same volume in both, even though they look very different. So an older child would go for the tall, skinny glass, thinking that it had more, or I'm sorry, a younger child would go for the tall, skinny glass, thinking it had more volume in it than an older child that would realize that the short glass can have the exact same volume as that tall, skinny glass. Does that make sense?
Intuition.
So if I had, let me, yeah, let's draw here. Okay. So if I have a tall, skinny glass and I have a short, wide glass here, and I say that I am going to put in a cup of orange juice. So here's our cup of orange juice in our short, wide glass. And here is our cup of orange juice in our tall, skinny glass. So even though both of those are a cup, they look very different. So a younger child is going to see this skinny glass and say, oh, it's higher up, so it's got more in it. An older child is going to realize that both of those vessels can hold the exact same amount of fluid, so it doesn't matter which one I choose. Does that make sense? Does that help? Okay.
Is that called like, I'm sorry.
That one's one of the trickier ones.
Is that called like intuition or something?
That is conservation.
Conservation, okay.
Yep. So matter doesn't change when the form is altered, and that's going to be your conservation. Formal operations. So this is our mature intellectual thought. So we see this in our adolescents. So they are able to understand abstract thinking. And that is understanding that things are real, even though we can't physically see or touch them. So we're looking at those things like justice, freedom, things that we know are real, but don't have something physical that we can grasp onto. So they're developing abstract thinking. They're also learning how to problem solve. What are all the possible outcomes that could happen if I go down this path? And they still have a sense of idealism. So that good in the world that exists, kind of that overarching principle there. So formal operations is advanced as our thinking is able to get. So looking in a nutshell, sensory motor, we're looking for that object permanence. We hide a toy under a blanket. The child goes and looks under that blanket for that toy. Our pre-operational stage, we're looking for that dramatic, imaginative play. Their creativity starts to develop at this point. Then concrete operations, we're doing that logical thinking, starting to understand cause and effect. So they're going to ask you tons of questions like, why did I get sick? Why did my dog die? Why can't pigs fly? We're just trying to figure out what's going on in the world. So we're going to ask lots of questions about it and want to know the answers to them and why something works or doesn't work. That's that concrete operation stage. And then finally, our formal operations is that abstract thinking, increased moral reasoning. We're going to think about thinking at this point. So we're going to think about crazy things like, what if we never discovered electricity? Where would we be? So things that, I mean, really aren't necessarily tied to everyday operations, that's going to be your formal operations. Okay, with Erickson, you're really just worried about the ages and this middle column with the different types of stages. We don't need to really worry about the virtue developed. Sometimes that helps people with a keyword, but don't get hung up on that last column on this slide with the virtue developed. So our infants, I feel like we've beat this one to a dead horse, but they are in trust versus mistrust. They are trusting in the people that are providing care for them, that they will meet their needs. So if I cry, mom will come and pick me up. If I cry, dad will feed me. And then if I cry for an extended period of time and nobody comes to see what is wrong, then I learn to mistrust others. So when my needs aren't met, I mistrust the people that are providing care for me, or I don't have that trust. Then our toddlers are going to be in autonomy versus shame and doubt. So they are learning independence, which is that autonomy, by being able to do things like controlling their own body secretions, that toilet training, saying no when they're asked to do something, and directing their motor play and activity. So they're going to have their own idea of what it is that they want to do, and they want to do it all by themselves. So toddlers are all about independence. If we are consistently criticizing our toddlers for exercising that independence, we are taking away that control, and they will develop this lack of control and a sense of shame about themselves, and they will be less likely to try things in the future. So they're going to doubt their abilities. So constant criticism causes them to doubt themselves and what they're capable of doing. Then we move into our preschool population, which is our initiative versus guilt. Do we initiate activities, meaning do we start them on our own? Do we play and consider new ideas as we're going? We're starting to learn other perspectives at this point. And then the opposite, that guilt stage, is where we are criticized, and that leads us to feeling guilty and giving us a lack of purpose. So our autonomy versus shame and doubt and initiative versus guilt kind of are really, really similar. If we are criticized for our attempt at something, we're not going to have that sense of purpose, that internal drive. So the reverse of those are both the guilt and the shame and doubt are very, very similar. So we're really looking at that autonomy. Are we exercising independence, or are we showing initiative? We're taking that step to do it on our own without being asked. Then we get into our school age, where we are in industry versus inferiority. So an industry is something that gives you a sense of pride and accomplishment. So that could be any activity that you're involved in or any interest that you have that gives you that sense of pride and accomplishment. If we feel we aren't meeting expectations, then we get that inferiority complex. We don't feel great about ourselves. We're going to be a little leery of trying new things and stepping out and possibly failing. So industry is going to be those activities that give us pride and accomplishment. Inferiority is when we're afraid of failing. Then the last one is identity versus role confusion. And that's our adolescent population. And they are really focused on what life is going to look like outside of our family. So when I leave the family, leave the nest, what is my life going to look like? Who am I going to hang out with? What am I going to believe in? What am I going to do for a living? Where am I going to live? all those adult decisions are going to develop your personal identity. If we aren't able to make these decisions or figure out where it is that we fit in, then we get role confusion. So we don't know where we fit in. We are unable to establish that identity. We're confused about what our future looks like. Do those make sense? Is there anything that you want me to clarify between the different ones? Gray areas? Okay. So infants, trust versus mistrust. Are my needs being met? It's going to be vital to moving through the next phases. Toddlers exercising that independence through autonomy, learning things like potty training, self-feeding, self-dressing, learning how to tell us what they're feeling, expressing their own needs. Preschoolers are in initiative versus guilt. We've learned how to do all these things on our own. Are we going to go out and do them, or are we going to sit back and wait for somebody to tell us to do them? School age, industry versus inferiority. We're learning about those activities that give us a sense of accomplishment, how to work as a team, develop some of those social skills. And then finally, adolescents are going to be in that identity versus role diffusion or role confusion, learning about their self-identity, their self-esteem, making those choices for life outside of the family. We are going to briefly talk about Maslow. So Maslow is that triangle hierarchy of needs. And we start at the very base of the triangle and we work our way to the top. So the very base of our triangle is our physical needs, our physiologic needs like air, water, food, being able to toilet, and having rest. Then once those needs are met, then we can satisfy our need for activity, where we're getting stimulation, we're seeing different changes and things. Then we move into our safety and keeping us protected from harm. And then love and belonging needs. So feeling a part of a group or belonging to somebody. And then we get to esteem. And this is our need to respect ourselves and be respected by others. So esteem is all about respect. And then finally, once we've achieved all of these, we can have self-actualization, where we become a complete person and we fulfill our greatest potential. So we have to start at the very bottom and work our way up to be a complete person. Questions there? Okay. Last theorist is Kohlberg, and he is all about moral development. So right and wrong. And this table breaks it down just like the video did, where you've got the substages as well. We don't have to go that in depth. We only need to remember our pre-conventional, our conventional, and our post-conventional stages. So pre-conventional is those purple stages that you see. So 4 to 7. We are doing the right thing because we are trying to please other people and avoid punishment. So we might not necessarily know why it's right or wrong. We just know that if we do it this way, then it makes our parents happy and we don't get punished. So it's a good outcome for us. Makes our parents happy. We don't necessarily know the reasoning behind it. We are really focused on ourselves and what the outcome is for ourselves in that pre-conventional stage. As we move into the conventional stage, that blue stage, this is all our school age population. We are starting to develop a conscience at this point. We understand rules and that internal set of standards that people have. And we have to follow our rules because it's important, and we please other people by being good. So this is where we see that good boy or good girl effect in our conventional stage, where I do this because I know it's good. And we want to keep those friend relationships. So I don't want to make you mad, so I'm going to do it this way. We are very, very fixated on rules. Remember, when we're starting to get into grade school, we've got our rules at home. We've got rules for our classroom. We might start doing after school activities and sports, and there's different rules there. So we are getting exposed to rules in large quantities. So that's how we're starting to develop our own conscience and learn how to determine whether something is right or wrong, is whether or not we're following the rules. So that is our conventional stage. And then lastly, we have post-conventional, which is the green one at the bottom. So this is where we have our own internalized ethical standards, so our beliefs on right and wrong. And that is what we use to base our decisions on. So we base our decisions based on that internal feeling of right and wrong. We understand that we need to do the right thing so that we can all live together in a nice, happy, cooperative environment. We can start to value multiple points of view and understand that people don't necessarily all feel the same way about situations. So people have differing moral approaches, and we can use our own thoughts plus the thoughts of other people to make decisions. So we're looking for mutual benefit. We're trying to make sure that we're following both our own morals and the legal rules that are out there to make our decisions, and trying to make life better for everybody around us. So that's going to be that post-conventional stage. Do we have questions there?
Did you say for Colbert to focus on pre-conventional, conventional, and the other one?
Yes. Yep.
Post-conventional?
So
Okay.
just those three. Don't worry about the different sub-stages that you see listed. Yeah, don't waste time with that. There it goes. So pre-conventional, we've got that desire to please others, avoid punishment. Conventional, we're working on being a good boy, good girl, developing our own conscience and following rules. And then post-conventional is where we are looking for the overall good of people in general, using our morals and our ethics to make decisions. Okay, so key things to know about our infants. We have two terms here. So a neonate is anybody that is just born until they reach 4 weeks of age. So the first 4 weeks of life, you are a neonate. After that, until you reach 1 year of age, you're an infant. As we're measuring our height and our weight throughout our first year, we expect that infant should double their birth weight by 6 months of age and triple it by the end of the first year. Their height should be a steady increase of about an inch a month for our first 6 months. And that should get us to be somewhere around 29 inches by the end of our first year. Other milestones that we're going to look for during that first year, we should be able to take some independent steps by the time we're 1, and our teeth should start coming in when we're about 6 months old. Our development of trust is important to healthy functioning. We have to have the right sensory stimulation to help us develop all of these skills that we expect at this age. So we can promote that stimulation through texture, sounds, colors. That's all going to kind of fall in with Piaget and our sensory motor stage here. We also need to look at techniques for coping with lethargic infants. So making sure that we are avoiding bright lights, moving them very slowly, speaking in a calm voice, sitting them upright at intervals. That slight change in position is just enough stimulation to get them to engage with you without overstimulating them. So don't forget about changing their positions. And then we are going to see them in the doctor's office constantly. So we need lots of visits during that first year to make sure that we're growing appropriately, we're getting all of our immunizations, and we have lots of opportunities for education and support. Some safety tips: make sure that we never leave a child unattended in a bath or on an elevated surface. They only need a couple inches of water to be able to drown, so they can't be unattended near open water anywhere. Same thing with an elevated surface, really easy for them to roll off. When we're doing SIDS education, we want to follow the ABCs of safe sleep. So we need to be alone on our back, in a crib or a bassinet on a firm mattress. Tummy time is going to be reserved for playtime. So putting the infant on their abdomen, allowing them to work on that head control is going to be reserved for times when they are awake and active rather than for a sleeping arrangement. Making sure that we know about car seat safety. We don't want to leave infants in a car seat for a prolonged period of time because of that 45-degree angle that the car seat sits in is the easiest for them to occlude their airway. So it makes it hard for them to keep their chins up and really easy for their head to fall forward and block their airway, which is why we don't want to use a car seat for a sleeping arrangement. We should be rear facing until we are at least a year old or below that height requirement on the seat. We need to weigh at least 22 pounds and make sure that we fit the weight requirement on our car seat. And the car seat should be in the center of the automobile so that we've got that extra cushion on either side if you were to get into an accident. If we're using a sling carrier, one of those fabric carriers to walk around with our child, make sure that their face is above that fabric and that we're not obstructing their mouth and their nose. Questions there? Okay. For nutrition for our infants, breast milk or formula, iron fortified formula are going to be our most desirable for the first 6 months. And then we will slowly start to work on adding in solid foods. Remember to be sensitive about breastfeeding. Not every mother is capable of breastfeeding, and that's perfectly fine. We want to promote it as much as possible, but know that iron fortified formula is going to be our next best choice, and there is nothing wrong with it. As parents are considering solid foods, they will decide whether or not they want to do organic foods and make food on their own versus store-bought foods. Teach them how to read nutrition labels. And if they are making food at home, it's important that they do not add any extra salt. They only use sugar sparingly. Remember, we can't use honey or whole cow's milk under a year of age. So honey puts us at risk of botulism. And with whole cow's milk, the has a high protein content and the whole fats that we expect, but that high protein content can cause GI bleeding. So that's why we avoid whole cow's milk for the first year. When they are cooking foods, we want to cook them just until they're tender. in as little water as possible so that we're not losing all the nutrients from our foods. Then we're going to strain or puree them and place them in ice cube trays so that we can prepare single servings at a time. So we know that they have a very small stomach capacity. So we're going to use that ice cube tray kind of as a guideline for matching that stomach capacity. 1 tablespoon per year of life. So really small amount that they're able to handle. Make sure you're only preparing 1 serving at a time so you're not wasting all that time you spent creating all these foods and having them go bad. So remember, once we eat something, put a spoon in something, then we can't just save it for another feeding. For introduction of solid foods, we're going to start with rice cereal because it's got the least chance of causing an allergic reaction. Then we're going to move into high quality fruits and vegetables and meats. And we want to start with single ingredient foods. So we want to start with just green beans rather than starting with mixed vegetables, where you've got multiple things that are being introduced that could mask one of those allergens that we're trying to assess for. So start with a single food at a time rather than mixed foods. And then hold off on fruit juices until we're 5 to 6 months old and drinking from a cup. Another thing that we don't talk about in class, but may show up on the test is fetal alcohol syndrome. So alcohol is one of the most abused substances by women of childbearing age. And we see this expressed in the fetus through growth restriction, intellectual impairments. They can have facial abnormalities, and they can have impaired adaptive functioning, which means they might not have good communication skills, social skills. They might not be able to do motor skills that allow them to do their activities of daily living. So those are all things that we're looking out for. And remember that we have no safe level of alcohol ingestion during pregnancy. We can't say that you can have one thing and not another. We just have to promote abstinence so that we're not potentially causing harm to a child. We consider an intake of 1 12-ounce beer or wine cooler, 1 5-ounce glass of wine, or 1.5 ounces of 80 proof liquor to cause, if you have one of those a day, you can cause serious adverse effects to your fetus. So that's why we are very, very careful about saying any amount of alcohol is okay in pregnancy. It's better to completely abstain. Questions about infants? Okay, so our toddlers are going to be our 1 to 3 year olds. At the time that they're 2.5, their birth weight should have quadrupled by now. We're going to see them learning those fine and gross motor skills, having increased hand-eye coordination, and being able to move around a lot more. They're learning how to do everything themselves. So toilet training, self-feeding, self-dressing, learning speech. As we are working with them on toilet training, we want to make sure that we're not leaving them unattended in the bathroom to where they can get into any dangerous things. We don't want to leave them there for a long period of time. We also don't want to punish them for accidents. Remember, we gain sphincter control between 18 and 24 months. So starting toilet training before that is not really going to be effective. But making sure that we're using that positive reinforcement, making it a positive experience for the child. Their stomach capacity is going to move towards that 3 meal a day schedule. They'll be able to process foods a lot more effectively. We expect them to be able to feed themselves by the time that they are 2. And remember, they still need that full fat diet all the way until they are 2 years old so that they can fully develop their central nervous system. So that fat is really essential for lubricating our central nervous system as we are growing. And then we expect them to have complete bowel and bladder control between 2.5 and 3 years. We know that Erickson says we are in autonomy versus shame and doubt, where we're able to gain that self-control. We start to see understanding of language and comprehension. Separation anxiety is also going to be apparent in our toddlers. As parents leave, we're going to see them have that initial stage of protest where they have that sudden outburst when parents leave. Then they're going to get into despair where they're really sad and withdrawn. And then finally, detachment is going to be that emotional coping mechanism where they are going to ignore their parents when they come back and be more concerned with their own activities and whatever they were doing while parents were gone. So we help to rebuild that relationship after parents return. And we'll talk about that a lot in week 4. So just remember those initial stages: protest, despair, and detachment. Parents need lots of guidance with handling the toddler temper tantrums and the constant saying no. We can see sibling rivalry crop up in this age group. So lots of guidance and support for parents on how to overcome these obstacles. And remember that our discipline for toddlers is focused on teaching rather than punishing. So those timeouts, 1 year of age, 1 minute, and setting those appropriate limits. Questions on toddlers? Okay. Preschoolers. So our preschoolers are getting ready for elementary school. They're learning how to start to develop that cooperative play where we can play together in a social environment and do the same things together. They're also still working through that control of body functions. They're more accepting of time away from their parents, increasing their communication skills, their attention span. These are going to be our 3 to 6 year olds. We're working on those gross and fine motor skills by learning how to do things like running, skipping, drawing pictures. And this is where Piaget says we have that symbolic thought process, and we are learning how to use our words for things. Erickson says we are developing initiative at this point. So are we willing to go out and do something on our own? Are we having some confidence in our skills and our abilities? And then Kohlberg says we are learning moral development, our right and wrong, by being aware of the needs of others. So in preschool, we see that their language develops really, really rapidly. They're starting to be able to construct complicated sentences by the end of the period, and they are still all about play. So their physical and mental well-being are all revolve around play. We're learning how to communicate and socialize with other people, and we need an outlet for all of our energy. So if we don't have a chance to get our wiggles out, we can't focus on anything. So lots of opportunities to get out our energy. We're learning cooperative and imaginative play. And we have a lot of big feelings that we're experiencing, and we have a hard time with expressing them and learning things like sharing and controlling our impulses. So those are other tasks that we have to develop at this stage. Some common parenting concerns are going to be knowing how to enforce those boundaries and those limits, handling jealousy, and then things like some thumb sucking and masturbation. So we know that thumb sucking, they will typically stop by the time that they go to grade school, naturally. And if we are trying to avoid thumb sucking, we want to provide encouragement and distraction to help get them into something other than their thumb. And then as far as masturbation goes, these children are learning about their body. So nothing malicious about it. They're just learning how their body functions. So we need to teach them the proper terminology for the body parts. And we also need to teach them the proper setting for exploring their body. So we want that to be in a private setting, not in the middle of school or in the middle of the mall. Primary enuresis, we talked about bedwetting. So primary enuresis is where we've never been dry before and we are wetting the bed. Secondary enuresis is where we are wetting the bed and we have been dry for over a year already. So we need to find the root cause of that to be able to make a plan for treatment. Table 18.1 in your textbook goes through kind of a nice snapshot of everything that we're learning in our preschool stage. So this is a great place to look for those theorists along with the developmental milestones, our language development, all in one fell swoop. So our 3-year-olds, we know our own gender. We have a short attention span of about 15 minutes. We're still going to be easily distracted. We're really focused on pleasing our parents, learning our roles, and expanding our vocabulary 300 to 800 words, learning how to form 3 and 4 word sentences, learning our numbers. We understand a lot more than we can tell you in person. And we're starting to understand good and bad, identifying more so with our same-sex parent. Really creative at this stage. Our 4-year-olds, we can count to 5, can do simple nursery rhymes and songs. Longer attention span here. We're starting to get into logical thinking. We might still have some temper tantrums that happen even when we're 4 as a coping mechanism. We can be very moody. We're going to be highly imaginative, asking questions about everything so that we can learn about our environment. And we like to show off our skills. So we might be extra aggressive in showing those off. We can use 4 and 5 word sentences. We're experimenting with new words. So we might use offensive language, not knowing the meaning behind it. We're going to be really active and can be rough and tumble in our play, learning how to control, learning where those limits are. They're going to like things that are active. They're not going to want to necessarily do that passive play where we're just doing puzzles. They need lots of repetition to be able to learn something. Our 5-year-olds are starting to understand time a little bit more. So past, present, and future become things that we understand. We know the days of the week. We can pay attention for a half hour at a time, count to 10. We should know our name and our address. Still relatively egocentric, so still focused on our own point of view. Should be able to use 6 to 8 word sentences, name multiple colors at this point. Starting to develop that hand preference by the time we're 5. And then our 6 to 12-year-olds, they're going to have that steady progression in their height and weight. Their teeth are going to be falling out and their permanent teeth coming in, working on those motor skills, that advanced thinking and grammar. Should be able to do complex sentences at this point. What else? Need to teach them safety measures, especially for things like bicycles and sports, making sure that they're using their protective equipment, keeping them safe on computers, monitoring their activity there. So we'll transition into our school agers, our 6 to 12-year-olds. We're getting more and more independent as time goes on. We're starting to perfect those skills that we learned as preschoolers. We talked about finding our industry or that sense of accomplishment, according to Erickson. Freud says we are in that sexual latency. We're going to be looking at those cognitive and physical skills rather than our sexual energy making our decisions for us. We are in our concrete operation stage according to Piaget, so that very logical thought process. Our growth slows down until we hit puberty, so we get a relief from that and we can work on mastering things. School also has an important influence on our socialization and understanding of how people interact and get along together. We start to be worried about, are we accepted into groups? Do we have friends that we can rely on? Our self-concept, how we view ourselves, is going to start to develop at this stage. And we're really in the early school age years, we're really going to stick to our same-sex friends until we start to get closer to adolescence, where we're going to start looking around for those opposite sex friends as well. Those co-ed groups. Language develops a lot during our school age years, and we learn how to communicate with words, whether or not we truly understand their meaning at the time. We're understanding right and wrong. We believe that we have to adhere to the rules because it's the right thing to do. Gonna start looking for those sports teams, phys ed classes, to meet that esteem need that we have for Maslow's hierarchy. So finding things that we're good at. If we have a child that is struggling with focusing and paying attention in class, then we want to look for any learning disabilities or delays that might be present. Do they need glasses? Do they have difficulty hearing? Is there some need that we are not meeting? So making sure that we're assessing for that. And then remembering our latchkey kids, which are left unsupervised after school typically, they are going to be at a higher rate of accidents and feeling isolated. Our adolescents begin when we see that appearance of our secondary sex characteristics at puberty, ends when we reach emotional maturity and we stop with that rapid growth. We are developing our sense of identity, finding out those tasks that are going to be important when we separate from the family, working on forming those first romantic relationships, and developing a career choice. Sexual latency, genital stage is going to be the last stage of Freud's theory for psychosexual development. So that's going to be our adolescence. And that's where we kind of go back to that sexual drive kicking in and looking for those long-term relationships. Our cognitive development, we talked about, we've got that abstract reasoning. We can think through consequences and different outcomes for our behaviors. We can think about things that we can't necessarily get our hands on. Our physical development during this period, we distinguish that by puberty, where our reproductive organs become functional, and we see those secondary sex characteristics. And then the things that we are working through are our rapid physical changes that are happening again, maintaining our sense of privacy. How do we deal with stress and pressure, and keeping those open communication lines? And how do we make those positive lifestyle choices? And we talked about in class, the #1 hazard for adolescents specifically is going to be motor vehicle accidents. For children as a whole, accidents in general are going to be our leading cause of death. As we are working through our nursing assessment, we're going to be working through that whole ADPI. So we're doing our assessment where we're observing, we're collecting data, then we're going to be planning what it is that we want to accomplish with our patient. Then we're going to implement that plan. We're going to actually go through all those steps together. And then we're going to evaluate how that worked. Did it work well? Is there something that we need to change? It's all the nursing process. So as we're determining nursing issues or diagnoses that are related to our patient, that is going to be part of that analysis phase of our nursing diagnosis. Does that make sense? So if we are trying to figure out what nursing issues and diagnoses are affecting our patient and what we're going to do for them, that's in that analysis phase, that analyzing. Our Denver 2 is going to be one of our tools that we use for our developmental screening. So one of those assessment tools that we have. The purpose of the Denver 2 is to measure a child's development. It doesn't test their intelligence. It looks at their personal, their social, their fine motor, their language, and their gross motor abilities. If we have a low score on a Denver 2 screening test, it means we need to do further investigation and evaluation. We can't make a diagnosis based off of a screening test. So this is just saying we have a risk somewhere. Can't tell us we've got a problem, can't give us a diagnosis, can't tell us there's necessarily something wrong. It's just saying, hey, you might want to look into this. So further testing is needed on any low score on a Denver 2 screening test. We talked about timeouts, 1 minute per 1 year of age. When we are measuring medications, our body surface area is the most accurate method for calculating those medication doses. So body surface area, most accurate for calculating medication doses in pediatric patients. When we are teaching sex ed to adolescents, we need to make sure that we are promoting privacy. So giving them a private, non-judgmental environment. We're being very truthful and honest, promoting that open communication. A lot of times nurses are considered a lot more trustworthy and less threatening than asking your parents. So you really want to make sure that you are providing that open, welcoming environment for questions so that we know that we're getting the right information out to them. For our healthcare adaptations, we talked about using our body surface area for calculating our medications. Because we know that pediatric patients absorb, distribute, metabolize, and excrete medications very differently because their organs aren't fully developed. So they're going to be less predictable to their response to medication than an adult. So we have to make sure we have that accurate weight in kilograms so that we can adjust and calculate their medications based on their weight. If we're doing IM injections, we want to use a large muscle group. So for our younger children, we're going to target that vastus lateralis. For our adolescents, we're going to try and use that deltoid. So unless it is a large volume or something that is extremely irritating, we're going to use our deltoid because it's a lot more private than having to do a ventrogluteal injection. So that's going to be our #1 choice, but both are appropriate. We have to keep an eye on our IV fluids because we are at high risk for fluid overload that can cause cardiac failure. So that's why we have to use IV pumps in pediatric patients, and we use those burettes underneath so that we can measure a lot easier than we can with an IV bag. Keeping accurate I's and O's. Making sure that if an infant is NPO, meaning they can't have anything by mouth, they still need to be able to have a pacifier. to meet those developmental needs. And then if you're asked to weigh a diaper to determine the output, we know that there is a 1-to-1 ratio. So 1 gram of wet diaper weight is going to be the same as 1 milliliter of output. So you're going to use that dry diaper to balance out, zero out your scale so that you're not weighing the actual diaper itself. Then you're going to figure out how many grams you had, and that's going to tell you how many milliliters of output your patient just had. And that's what you'll record on your INO. And then last healthcare adaptation that we have to worry about are airway obstructions. So for our infants, we do those chest thrusts and then flip them over and do their back blows. For an older child that can stand, we can do their abdominal thrusts just like we would on an adult patient, but we have to make sure that we don't pick them up off the floor when we're doing those abdominal thrusts. And then the one thing that everybody has been wondering about are those dosage calculation questions. So make sure that you know how to convert pounds to kilograms. So in order to do that, we're going to take our weight in pounds and divide by 2.2, and that will give us our weight in kilograms. And then the types of questions that we're going to ask you to calculate milligrams per kilogram per day or per dose. So being able to calculate a dose based on that child's weight. We're going to give you a dosage and tell you how much pharmacy sent up for you and make sure that you can calculate what your order is based on what pharmacy sent up to you. And then making sure that you can calculate IV rates. So if we're doing a continuous infusion, knowing how many milliliters an hour to set your IV pump. Or if we're doing something like heparin or insulin, those questions come up a lot. So understanding how to do those dosage calculations. If you are somebody that struggles with dosage calculations, we posted a lot of really great resource videos and practice sheets for you that all have the answers. So you can look back and see and double check your work and make sure you got it correct. If you're still struggling, I'm happy to meet with you one-on-one. Or Professor Bogart is a really awesome math tutor. So either one of us are available to help you one-on-one, make sure that we get you squared away so that these are easy 5 questions for you and a very easy 10 points on your exam and not a struggle.
You said like what the pharmacy sent up, so like desire perhaps.
Yes. Yep. Yeah. Yep. So if you have an order to give 10 milligrams twice a day and pharmacy sends you 50 milligrams in 10 milliliters, how many milliliters are you going to give? Questions like that. What questions do you guys have? Wonderful.